All right, we'll go ahead and get started since it's 10 o'clock. Good morning, everyone, and welcome to our dental professionals panel for the first ever Iowa State Pre-Health Conference. We're very excited for everyone to be here and hope this is a great experience for everyone. It's our first try, so hope it works out. My name is Seth Deal. I'm a junior and I'm one of our dental outreach chairs. Jackson on the panel is the other dental outreach chair. He's also a junior, and he's going to be moderating the chats and stuff today. If you have any questions, he put this in the chat, but if you have any questions that come up during this Q&A, feel free to use the Q&A function on Zoom, and we'll go ahead and ask the panelists. Today on our panel, we have Dr. Bullock from the University of Utah and Dr. Stevenson from West Des Moines, Iowa. I'll go ahead and let them introduce themselves, and then we'll get started. Dr. Bullock, we can start with you.
Good morning, everybody. Thank you for having me from Utah to Iowa today. I'm Dr. Jerry Bullock. I'm the Associate Dean for Clinical Affairs and Director of Admissions for the University of Utah School of Dentistry. I graduated from Loma Linda's School of Dentistry in California and then practiced back east for 6 years before coming back out to the West Coast to join the University of Utah. So I'm really excited to hear from you guys, answer any questions you might have. My background is in community-based dentistry. So I worked in federally qualified health centers and directed 2 of those, one in Vermont and one in Virginia. And so I can give you that perspective. Again, thank you for having me here today.
And I'm Andy Stevenson. I spend most of my time practicing in West Des Moines 4 days a week. And then I actually do every Monday head over to the University of Iowa and work with senior dental students in the Department of Family Dentistry. I'm a 2016 graduate of the University of Iowa College of Dentistry. And my background is primarily private practice dentistry.
Awesome. Thank you, guys. We're really excited to have you guys here. So we'll kind of just start off. Pretty common question, but Dr. Stevenson, we can just start with you. What inspired your interest in dentistry?
That's a good question that I don't have a very inspired answer to. My dad's a dentist, so I kind of grew up around it. The day I turned 14, I got marched into the office and I was declared the janitor and did that up until I graduated from high school. So it was just kind of something I grew up around. I always really liked the medical fields and sciences. And at the same time, life or death situations made me very nervous. So dentistry seemed like a good fit.
Absolutely.
And I joined dentistry. I've worked in every position in a dental office you can think of. I was headed down the pre-medical route through undergraduate. I even went on medical school interviews and decided then that wasn't the route for me. So then I started working in a dental office as a receptionist, moved to a dental assistant, was a hygiene assistant, and then worked in those positions as I was applying for dental school. And then my passion for community-based dentistry really started from my upbringing. I grew up in a lower socioeconomic community out in a rural area, and we really didn't have much access to dental care or consistent dental providers. So I wanted to be a dentist that served communities like that with quality care, and that's really been my passion and what I enjoy doing most and sharing with our students.
Absolutely, yeah. So then what does a typical workday look for you guys? Because I know it's a little bit different because Dr. Stevenson, you're in private practice for the most part, and then Dr. Bullock, like you said, you do more community-based stuff. So sort of what goes on in a typical day for you?
Should I start on that one?
Yeah, go ahead, sorry.
Okay. So a typical day is it's run very similar to a private practice. I would say we have to juggle resources a little bit more and find avenues for financial assistance for our patients more than private practice. Most of the health centers that I work in have a sliding fee scale. So the scope of service is a little bit more limited. We do a lot more bread and butter dentistry, a lot of fillings. we do a lot of extractions, a lot of rehabilitation with removable prosthetics like dentures. We do some crowns for our patients. It just depends on what the level of coverage is for the individual. So that does make it a little bit different than private practice in that sense. So we do probably a larger number of smaller procedures rather than a less number of large procedures.
And from my vantage point, normal's kind of a moving target these days, so take that with a grain of salt. But my practice, I work in a 3-doctor practice, and we kind of, especially what I do on a daily basis, I typically see about 5 patients, and a lot of what I'm doing is larger cases, rehabilitative stuff, while mixing in, we typically have about 3 hygienists on any given day. So doing hygiene checks, checking people's teeth, and a usual treatment time block for me is about 2 hours. So I do have a little bit, I'm sure a little slower pace than Dr. Bullock does.
Yeah,
Great.
I'd say we see anywhere between 8 to 13 people on a doctor schedule, and then mix in hygiene on top of that.
Cool. Dr. Stevenson, you mentioned that you work in a 3-doctor practice. Sort of like, what's the dynamic with you and the other dentists that you work with? Like, are you all general dentists, and how do you guys work together and share patients and things like that?
That's a good question, and again, ever evolving. One of the dentists is my dad, so that's always interesting. And the other one just joined us this year, so we're still figuring that out ourselves. But we do kind of subspecialize. That's kind of the wrong word to use within the practice. For example, I do not like doing root canals any more than most of our patients enjoy them. So I do not really do any root canals. My dad really enjoys them. So within the practice, he kind of handles that. I really enjoy pros, that is dentures, removable partial dentures, and increasingly a lot of implant work. So I handle most of that within the practice. And Dr. May, our newest addition, is a really strong surgeon. So she handles most of our extractions. So we don't do everything in-house, but we do try and keep as much as we can at the general dentist level. We are all true general dentists, but try and stick with what we enjoy, and hopefully that rubs off on our patients' experiences.
Yeah, very cool. So another question that we had from a few people actually was, what is the most challenging experience that you've encountered during your time as a dentist? Dr. Bullock, we can start with you.
That's a really good question. Most challenging experience. I think patient management it can be challenging. Patient expectations can be greater than what is realistically delivered. And I think that can be challenging to make sure that the patient has realistic expectations. Everybody wants that white Hollywood smile. And sometimes that just isn't in the cards for them for a variety of reasons. And I'd say one of my most challenging experiences with just dealing with a patient who was upset that we couldn't get her to the level that she wanted, and we bent over backwards to get it as ideal as we could, and what we felt was clinically acceptable, but that it just wasn't to the level that she wanted. So dealing with that can be really hard as a dentist, and we're all perfectionists. We want to be the best, and dentistry it's not a perfect game. And so that can be challenging as well as a dentist.
Yeah, I totally agree with that. As someone who just got chewed out by a patient for a total of 30 minutes the last 5 days for something, and kind of going off the perfectionist standpoint, which is very, very common in dentistry, you can do everything right and still have a bad outcome. And just trying to explain that to a patient and live with that yourself is really challenging, and you want to beat yourself up a lot about it, even though again, you did everything right. So just kind of learning to live with that is a constant challenge for me in addition to managing patient expectations. And those two kind of go hand in hand.
Absolutely. So then another question we had is how similar or different is it working in your professional field from dental school? Like when you guys were working with patients and just kind of across the board clinically, what's sort of the similarities and differences of your jobs now? Dr. Stevenson, we can start with you.
Speed and pace. At the University of Iowa, you typically schedule one patient in the morning, one patient in the afternoon, basically until the final semester of your career. So you will not make rent at that pace in the real world. So learning how to scale up from that, and some of that's a lot easier when you're no longer having someone look over your shoulder and get all the check marks. But some of that is you gotta get after it and kind of push yourself a little bit. And your imperfections become glaringly obvious, if only to you, but that to me was the biggest change.
Yeah, and I think you no longer have that safety net, and and I see it with our students when they first get out, and we have, first year alumni reaching back to us and going, how do I handle this case? So I think the really important part of when you graduate is finding a mentor line for you that you can call on, whether that's, somebody you're working with, a senior dentist that you're working with, or a classmate or a faculty member that you had in dental school. But it can be really hard to make that call now, and to make that definitive decision, and it's nice to have that in dental school where, yeah, you get the thumbs up on something before you start it, and then when you get out into real world, it's you, and you want to make sure that one, you're ethical and you're not going to get sued over something, but two, that you're doing a good job and it's the right thing to do for your patient. And so that can be pretty scary, and along with the speed factor, I think is huge as well. So find a great mentor who can help you develop those critical thinking and gain that confidence when you first come out.
Dr. Bullock, you just mentioned like you'll have first year graduates coming back and asking you questions. I feel like a lot of people just assume that you go to dental school, you do your 4 years, and then you pop out, you're just a dentist and you can just do it. So sort of what's that transition like? I mean, obviously from your guys' experience and also from experience you guys are both in still involved in academia, like with new graduate students that then come back and ask for help, is that super common or how does that usually work?
It's something we encourage at the University of Utah. We're very open. We're a small school. We only have 50 students per class. So when you graduate 50 students, we're pretty close to them as faculty members. And so I think that opens the door up for that opportunity to collaborate, because now it's not, there's no, I'm here, you're here. We're colleagues now. You're graduated, you're licensed dentist. So it is a collaboration. It's a brainstorming session. And like you would go to a CE, it's just, it's, you work up the case together, and you take the best ideas. So we really encourage that for our students. And it's something that I looked for when I first came out, and I didn't find it in the practice that I was working in. And so I had to find it in an outside resource of a different practice. And so you'll find it. It's good to, if you can find it early on, and it's good to have in your back pocket whenever you need it.
Yeah, I agree with all that. When I actually started going back to the university as an adjunct professor, selfishly to learn more myself and to get back now that I'd gotten out and learned some things on my own, made some mistakes, start to rub shoulders with my mentors there again. Working with my dad is great, and I certainly ask him a lot of questions. But as we speak right now, in my bag around the corner, I've got a case to go and show when I'm at the university on Monday to get the opinion of others on. So I don't have a lot of experience mentoring new graduates. I usually try and steer them as someone who's only been out 4.5 years myself towards people with a little bit more experience, because I really consider myself still a mentee at this point.
Absolutely. Earlier, you guys both mentioned like the change in pace from dental school into when you actually start practicing and you start treating your own patients. We had a question in the chat. They were wondering, have either of you guys ever felt burnt out or very drained from dentistry? And if so, like, how do you come back from something like that? Dr. Stevenson, we can start with you.
Yeah, that's a good question, especially in COVID times. This last year has been exceptionally difficult on everybody, and when you consider, we run a small business. We were closed down for 8 weeks. I was living off my emergency funds. It was a stressful time, and definitely have had some burnout since. My kind of course back to that I'm still on has been bringing in a third doctor and kind of changing my schedule to be a little bit more of what I really enjoy, kind of taking a step back. My pay will probably take a little bit of a hit, but seeing fewer patients and just kind of really getting back to the things that I enjoy. And at least for the short time, for example, I've only done 2 fillings yet this year. And I've really been focusing on what my favorite things, if you will. So I don't know if that'll be successful in the long term, but that's what I've come up with so far.
Yeah, I agree with that. I think everybody faces burnout at some point and multiple times. And it could be for various reasons. It could be because of the pandemic. It could be, you're not getting enough new patients in, or just the pace that you're working at is unsustainable. And I think you just have to take a step back and reevaluate, like Dr. Stevenson did, and get back to what you really enjoy. And it could be some patients that are just not easy to work with. That for me is probably can be more draining than the dentistry itself. And you have to decide, is that patient worth keeping in your practice, or do you refer them to somewhere where it might be a better fit for them? And those are tough decisions, because those are personal decisions that you have to make. Bouncing back from burnout, it can be tough, and you can easily go back and revert into that same rut, so to speak, that burned you out in the first place. And so you just really have to be intentional with your schedule. You have to, prioritize what you enjoy doing, and that makes things a lot easier.
Absolutely, yeah. So another question we had was, what do you wish that you knew before you entered your field? Now that you guys are at least slightly developed into being like a dentist for a while, what's something that you wish you had known beforehand? Dr. Bullock, we can start with you.
Oh gosh, something beforehand. That's a really good question, and that's a tough one. So I graduated in 2011, so I've been in practice for quite a while. I don't know, that that's tough for me. I guess beforehand, I guess I didn't realize, like a small business owner, it doesn't stop at 5. You're that provider, you're always on call. You have to manage the business side when you're not with patients. And I think that's something that I didn't realize. I thought it was different from medical, in that, hey, I'm 8 to 5, I'm good, 4 days a week, cool. No, it is probably far more than that. And Dr. Stevenson can probably speak to that a little bit more than I can.
Yeah, I every time my phone rings, I just get the shivers a little bit. You never know when you're going to have to go in. I'll answer that question maybe a little bit different way. One skill that I wish I would have developed more before dental school and even after was kind of mental resiliency. Just knowing that things aren't going to go well right from the start. And when they don't, just not really expect it, but just roll with it and figure out the best way out. And that's something that you start to learn very slowly in this business. But I kind of wish I would have just learned to take a deep breath and roll with the punches sooner.
Hmm. So sort of bouncing off something you said, Dr. Bullock, we had a question in the chat asking what the business side of dentistry is like. You mentioned how it was like sort of difficult for you to transition into becoming more than what you expected from your 8 to 5 job. So what's the business side of dentistry like for each of you? Dr. Stevenson, we can start with you.
A lot more time than you realize is how I would describe it. I can't tell you the last time I didn't go into the office on a weekend. I've already been there once today. You just spend just so much more time there, especially my first year out. I was, seeing patients 5 days a week, but I was pretty easily putting in 55, 60 hours, just kind of perfecting things, all manner of small things, from clinical notes, templates, and all kinds of things like that. And even now, payroll, managing staff, keeping up on all the compliance stuff is an ever increasing part of dentistry. It is I pretty much every day I spend my last 2 hours doing just paperwork, whether it's for patients or writing letters to specialists, and making sure that we're on the up and up with all of our government compliance stuff.
Yeah, and very similar. And we're not saying these things to scare you, but this is reality and you've got to be prepared for it. We still love our jobs and we would do it again. But yeah, a lot more paperwork, which usually happens after hours because when patients are there, you're focused on the patient. Uh, that's, like he said, payroll, that's ordering supplies and double checking invoices, monitoring your lab costs, looking for new labs that might give a superior product for less of a price. It's balancing all of that so that in the end, you can make a good living and you can support your staff. And we're still pretty early in our careers, so we're still very involved with all that stuff. And hopefully as we move further into our careers, we have it down more and we can transition out of that a little bit more. That's typically how you see a dental career going. So in your later years, usually you don't do too much of that. I mean, there's certainly some people who do, but us in our early careers are, I think, far more involved.
Very cool. Yeah. So what is one piece of advice that you would give to someone in like our shoes as an undergrad that's sort of approaching application deadlines and about to, hopefully all of us, enter dental school? What's a piece of advice that you would give to someone that's approaching their dental career, like the start of it? Dr. Bullock, we'll start with you.
The start of the dental career, it's going to be challenging, and dental school is tough and it's going to have its tough days, but it's an extremely rewarding career. And from all aspects, you can have a great lifestyle, you get to make an impact on people's lives, you get to be a leader within your community. And I think all of those things are things that you need to look back on those hard days and remember why you're getting into this, and know that it's going to get better.
And I would say figure out how you learn and really master that. The first 2 years of dental school are just all about getting information into your head, not necessarily cramming, but trying to make some sense of it. So just kind of be prepared for the amount of information that you need to understand. For me, it felt like easily double or triple what my undergrad experience was. And then the last 2 years, at least at the University of Iowa, is more patient focused. And that's where that resiliency kind of comes into play, I think.
Absolutely. So another question that just came in the chat: what did you guys look for when you were going into dental school. So, I mean, Dr. Stevenson, I know you're from Iowa, and then you went out west for your dental school, and then ended up coming back here. So, what what did you like? What did you see about school over there?
I actually graduated from the University of Iowa. I did do my
Oh wait, yeah,
undergrad out in
sorry,
Colorado.
undergrad, yeah.
No, you're totally fine. I don't really have a good answer for that. I did not really understand that you could apply to multiple dental schools, so I went with the one that took me. So don't do what I did, is I guess what I would say. So yeah, sorry. As you guys are probably well aware, the most dental schools in late December send out their letters. I got mine on February 8th. So I was a late admit. So I'm the wrong person to ask that question of.
And I'll speak, I think, from my admissions cap. Look for schools that are going to give you what you want. If you want a lot of research, look for schools that are more focused on research. If you want a lot of clinical experience, look for schools that are going to give you a lot of clinical experience. Or if there's a particular specialty, let's say like oral pathology, not every school has an oral pathologist, so you need to look at schools that have oral pathology. So it's hard to know what you want before you go in. But more importantly, look at schools that share your same values. For me, it was, like I said, community outreach. And so I looked for schools who had a large outreach of service. They were very service minded. And class size also was a factor for me. And so I preferred a small to medium class size. There's some class sizes, there are 300 students. So you've got to really look at class sizes when you are applying and decide what works best for you. And then cost. Dental school is expensive and it can take a long time to pay it back. So as you're making your decision, if everything, compares to each other and it comes down to cost, you might want to consider taking a lower cost option.
Awesome, yeah. So then people were also curious for your guys' admission processes. What was the hardest part of the admissions process for each of you guys? Dr. Bullock, we can start with you.
I think the hardest part was the interview. It's just nerve-wracking. At that time, I was less comfortable speaking in groups, and some of my interviews had they were large group interviews, and so that was hard to put like my best face forward and talk about myself. You have to learn how to talk about yourself in a positive way, but not sound like you're boasting. And that can be a challenge. So I'd say the interviews were my most nerve-wracking part.
Yeah, I agree. I have very little recollection of the interview at all. It just kind of blacked out in my mind. I was exceptionally nervous, and in that is the only part that doesn't take place on paper for the most part. So everywhere else I could dot my i's and cross my t's and all that. But with the interview, it's all you. So that was difficult, and it's hard to prepare for. You just kind of have to calm yourself and do the best you can.
Absolutely. So if you could go back and do it all over again, whether it was school, dental school, into your new career, or the careers that you guys have, is there anything that you guys would change about the journey that you took? Dr. Stevenson, we can start with you.
Nothing really comes out to the top of my head other than just to take it not less seriously, but not worry about it so much. In the moment, everything seems like a total crisis when your denture doesn't fit. But in hindsight, it's all water under the bridge. So just not worrying about it so much in the moment, and worry more about learning than anything else is kind of the one thing I would change, just to decrease my stress level throughout.
Yeah, I agree. I think that type A perfectionist end of a typical dentist is very hard in dental schools because you're going to have failures throughout dental school, and then um, realizing that that's going to happen and being okay with it and then learning from it and moving on. That was a tough part for me. I remember the real wake up call was getting like a C on one of our lab anatomy tests, and I had a breakdown. Like it was the end of the world. Um, and so I had to really learn how to pick myself up from that. And that was my first failure, but it was not the last failure throughout dental school. And so I think if, like Dr. Stevenson said, if you can learn how to build that resiliency and be comfortable being uncomfortable in that situation, you'll serve yourself well.
Absolutely. I feel like something that people just assume, like I said earlier, is when you pop out like of school, you're perfect dentist, you know everything, all the right moves and all the right things to do. Um, so how do you guys sort of handle like mistakes that are made? Because nobody's perfect. So there obviously are situations where you could have done something better. So like while you're practicing and working in a clinical setting, like how do you handle your mistakes and move forward from them? Dr. Bullock, we can start with you.
Yeah, and you know, I could do a class 2 and it's not exactly the right shade that I can see. And I wear 6.5 magnification, so I see a lot. But it's clinically acceptable and nobody sees the flaws like I see the flaws. And so that's something that I have to keep in mind always. But true mistakes do happen. And it's just, you have to be open and honest with the patient and be like, this crown came back from the lab. It's not the shade that we thought it was going to match perfectly. It's not matching perfectly. We're going to have to take a new shade, or it's not fitting appropriately. We have to take a new impression. Patients understand that things don't go perfect the first time. And if you're open and honest and just communicate that with them, they're usually fine. It's hard on the ego, but I think communication is the biggest factor when it comes to a mistake.
My line that I got to use yesterday is I'm not perfect, but I'm honest, and this isn't as good as I want it to be. And then you make it right to the patient. And while I've certainly had some disappointment, I've never had a patient angry or fault me for that. They really can't be when you're saying I'm not going to put anything less than good in your mouth. They get that, they understand that, and I think deep down they appreciate it. I've even had a few patients who, even they were disappointed day of, they come back to be your biggest advocate 6 months down the line, because they don't remember the disappointment, but they do remember your the quality that you were looking for.
Hmm. And obviously, everyone's not a perfect patient. So, how do you guys deal with someone who either is upset with you for whatever reason, or they might be afraid of whatever procedure you're going to do? How do you guys handle that? Dr. Stevenson, we can start with you.
I'm very confrontationally intolerant, so I'm pretty quick to say, let's, if it's something minor, we're not gonna charge you. I know some dentists will kind of immediately dismiss the patient. In the state of Iowa, there's some weird legal stuff with that. So I'm just not looking to do that. I've only done it once ever. But most of the time, you do your best to make it right, and they might never come back, and it kind of just turns into water under the bridge. But I'm pretty quick to make it right, even if I lose money in the process. And you might lose a patient, but I just do everything I can to fix it.
Yeah, I'm of the similar mindset. I would rather write off $1,000 crown than go to a legal battle or have it dragged to the dental state board. Make it right. If you have to it be a wash. As far as production goes, it's a wash. Those cases don't happen that often, or they shouldn't happen that often. Um, uh, and I think it's just being empathetic to the patient situation. If the patient's scared, just understanding where they're coming from and take it slow. Sometimes people just need to move a little slower than what we know what we want to do. We're ready to go, but sometimes patients just need more time to settle into that. So sometimes we have to step back and say, okay, they're not ready, or they need to be more in control, and say, okay, are you ready for the injection now? Are you ready to start the procedure? Do you feel numb enough? Giving the patients that control it usually helps in the fear situation or the anxiety situation, because they've got PTSD from some other experience where they didn't feel like they were in control. So if you can empower them and make them part of the process, I think that really helps.
Absolutely. We just had a question pop up in the chat. Do you guys find that kids or adults make better patients? Dr. Bullock.
I do a lot of work with kids and special healthcare needs patients. It just totally depends. I love kids. I can see, a couple on my schedule each day. I can't do them all day long. It's very exhausting. You have to be on, so to speak, when you're working with kids. And you have to do that sometimes with adults, but it's less mentally taxing for me to work with adults.
I agree 100%. Kids are just absolutely exhausting for me. I do it as I need to, but I could not make a practice of it. And I do cringe just a little bit every time I see a child operative in the chair. It's just not my mindset and not what I'm good at.
Sure. Another question we had in the chat was, what do you guys think would be the most beneficial thing for someone to do during their gap year that they take before dental school? Dr. Bullock, do you have thoughts on that?
So me as an admissions director says, go and do shadowing and community service. Me as a dentist and former dental student says, go travel, go do something you want to do. And maybe it falls in between, go do some traveling, go experience something before dental school, because for the next 4 years, you're locked down. You have breaks here and there, 2 weeks here, 2 weeks there. But go do something you enjoy. If you're shy on some things you need to put on your application, then go and do that. But don't lose sight of enjoying that year off.
I do not have a background in admissions, so I take my answer with a grain of salt. I think it kind of depends on what you want to do long term. If you're someone who's really into research, having a little bit of research might, if that's something you enjoy, I do think there's taking advantage of kind of the breath of fresh air, whether it's traveling or doing whatever you need to do to kind of relax, because dental school is rewarding but exceptionally difficult. Also, one thing that I think would have really interesting for myself, and knowing where my weaknesses are now, is to do something like working in a restaurant where you get customer service skills, or having to juggle lots of things at the same time, and that would go really nicely with having free time to do whatever you need to. So there's some creative things that probably don't look great in an application, but when you've got 3 hygienists all looking for you at the exact same time, and you're struggling to get this guy numb so you can do a filling on him, I would imagine that's very much like some of the stresses that you can learn in other areas as well.
Absolutely. So a couple other questions from our Q&A. Did you guys have a lot of shadowing hours when you applied, and how did you get those hours in? Dr. Stevenson, I'm sure you did because your dad was a dentist, but if you'd like to elaborate on that.
Yeah, I don't know if this is a thing anymore, to be honest, but at the time, in the state of Iowa, you could become a dental assistant by shadowing. So I did on-the-job training. I took the test to do that. And I actually was a dental assistant for a couple of years, working both in his office as well as an orthodontist office over the summers. So I did quite a bit of that, actual chairside assisting. I was a terrible assistant, but that was kind of my experience.
Yeah, I was working in dental offices, so as a dental assistant and a front end. I did get in other shadowing experiences just from like the oral surgeon that we were referring to from that office, or the orthodontist. So I was able to leverage some of those relationships that our office had to get additional shadowing with them.
Cool. We have a few people asking pretty similar questions. So after you graduated and got your license, was it hard to figure out where you wanted to go from there? And like, what was it like going into the practices that you guys started out in? Dr. Bullock?
It was really hard for me to figure out where I wanted to be. I knew I wanted to go work in health centers. So that area I knew, but I didn't know where or that was going to lead me. So I just sat down and said, okay, what do I want out of a place where I want to live? I want mountains and I want to be able to mountain bike. And so I just took some like geographic features that I wanted and then started looking for practices in those particular areas. And then that's kind of where I settled at my first practice in Vermont. Um, it I'd never been to Vermont before that, so I loved living there, but I probably didn't flesh out the practice as well as I should have. And the first year was pretty hard, and I spent 3 years there. But I probably didn't do my due diligence in fleshing out the practice itself and the other doctors that were working there.
And my experience was kind of almost the exact opposite of Dr. Bullock's, in that I knew the doctor I was getting in with since I practiced with my dad. But for me, the big pull was geography. So I actually spent quite a bit of time looking at going back to Colorado. In fact, still to this day, if you go to denver.dental, you'll see my face because I can't quite give it up just yet. But I ended up going back to Iowa and giving up the mountains and skiing and all the things that I really enjoyed about the West. But I kind of, my rationale was I wanted to kind of focus on my career and doing it close to where I grew up, working with my dad, who's an okay mentor, and being close to the university and being able to go back and get some real mentorship was kind of my rationale.
Very cool. Yeah. One question that some people are pretty interested in is if you guys had the ability to change anything about the profession, what's something that you would want to see change? Dr. Bullock?
I absolutely despise insurance companies. So, and we're really ahead of the game, like than the medical field is, but I really do feel like if we could have more control over the fee structures that insurance companies put out and make it more equitable. I think that that is something, as I'm an ADA member, and that's always something that I ask my representative for the ADA to lobby for. So that's something that I think has always been a struggle and continues to be a struggle for dentists.
I 100% agree. That's the answer I came up with as well. Being told what you're going to get paid for a certain procedure by someone who's never looked in the patient's mouth is very difficult, and was very frustrating for me the first year, to the point where I tried to rock the boat a little bit and had the CEO of Delta Dental of Iowa on the phone and got nowhere. But it is definitely a challenge working with these companies and trying to do the right thing for your patients and not let that guide treatment, even though the most recent statistic that I've seen is dental insurance disbursement goes down about 3% every year, despite prices going up, inflation and all that. So you really have to contend with that. And there's a lot going on behind the scenes with that, with the ADA. But those companies have deep pockets and a lot of influence.
Yeah, absolutely. So there's clearly a lot of stress and other things that go into your jobs. What do you guys do specifically to maintain your work-life balance and your sanity a little bit? Dr. Stevenson?
Well, that's hard to answer these days. I enjoy running, and that kind of, for me, I'm not very good at it, but it's a de-stressor for me. Um, I'm single, so that makes my life a bit easier too. And I'm probably live out of balance, but nobody knows that but me. So I don't have a great answer to that. But yeah, just kind of finding the time for making time for yourself on the weekends, even though you're always worrying about your phone ringing. But it's hard. I found it difficult, but it kind of comes with the profession, and it is kind of only as stressful as you make it for yourself. So you do have to, it's a learned trait.
Yeah, I think I was still at 5 years, still struggling with that. Now that I'm 10 years out, I think I have a little bit better grasp on keeping that balance. So it does come, and I think it'll continue to evolve even better. For me, like I said, I'm a big mountain biker. I'm a big skier. I love the mountains. So just stepping away and getting outside is extremely important. I am married and I have a 5-year-old daughter. So making specific time for them and trying to step away from the phone or work. I'll get up at 5 and work for an hour before everybody else gets up. And that usually helps me focus more on them when they're up and we're together as a family. So you get creative with it, but you gotta have that release, whether it's running or painting or whatever that is, but you gotta have some other enjoyment outside of just dentistry.
Absolutely. Sadly, it's looking like we're almost out of time. So do either of you guys have any lasting advice, words of wisdom that you think would be good for everyone that's attending to hear, just about life, dentistry, dental school, anything in general?
I I absolutely love the career of dentistry, and I will, every time I have a young person in my chair, I'm like, you want to be a dentist? You know, I love sharing that with anybody who will listen. As a mom, I love this career because I can make my own schedule. I can be a primary breadwinner for my family, and it's just awesome, and I'm so glad you guys are pursuing it. You'll find you'll love it. It's not for everybody. There are some people who get in it and said it's not for me, and that's totally great. But it's just a wonderful career, even though we've talked about some of the hard things today.
Yeah, I agree. Dental school is a gauntlet. It is tough. There were a lot of days where I would be in the building before the sun was up and leave after the sun set. That was pretty typical for me the last couple of years, and we've definitely aired some dirty laundry here today, and kind of the bad side. But the beauty of it at the same time is you have the power to kind of control your own destiny. So I told you I was getting burnt out on this, that, and the other. I had the power, and I didn't really have to clear it by anybody to walk up front and say, okay, we're changing my schedule. This is what I'm doing now. So there's the flip side of that is that you're kind of in control. And so you've got nobody to blame but yourself in situations like that. So that, I think, is understated. But other than that, good luck. Take yourself seriously, but not too seriously. That's all I got.
Awesome. Thank you guys so much. You guys were great panelists. We were really lucky to have you guys. Thank you to everyone who's attending. And for those of you students who are attending, Jack threw the link to our conference website in the chat, and he'll throw it in there again. Just for whatever session you plan on attending next, go ahead and hop onto that website and find whatever you're interested in for our next session. Thank you to everyone for coming out, and I think this went really well. I appreciate you guys.
Thank you.
Thank you.
Bye.